doctor when I was 12. I don't know how I knew, but I always wanted to help people. I've been in practice for 37 years, and I deliver about 500 babies a year. The MAVEN Project started when I was having a conversation with one of the professors who taught me in medical school, who was about to retire. And he was very concerned about how he could use this vast amount of medical knowledge and still remain relevant. Open up. Because there's a real crisis in this country. We are short primary care physicians. We are short physicians in general. And no one really has a great solution to how we're going to solve this disparity between the availability of physician manpower and the need, especially in underserved communities. And one way to meet that need is for physicians to do volunteer work. It's part of what being a doctor means as far as I'm concerned. The doctors we're interested in recruiting would be doctors that are retired or semi-retired, some of the doctors that are working part-time. And there are 250,000 retired or semi-retired doctors in this country. Many retire relatively young at the age of 55 to 60. In fact, a third of the doctors in this country are over the age of 55. And many of them have time and they want to be relevant. They don't necessarily want to go to the third world to provide care. They'd love to do it more locally. They'd love to do it with telemedicine. They recognize the need. And our goal is to try to recruit them and meet their desires with the needs in the safety net clinics around the country. Specialty services are terribly needed because there are primary care providers in some of the clinics. Nurse practitioners throughout the country are serving primary care roles in the clinics, but they don't have the specialty services. They don't have the support of experts in the areas where many individuals who come to safety net clinics have need. In areas of psychiatry, liver disease and gastroenterology, in endocrinology. Some doctors will actually go to clinics and volunteer and take care of patients in person. Others will be available for what we call curbside consults, an email, a text, a phone call, to answer an immediate question that the clinicians in the remote clinics need answered immediately. And then the third way is to have more prolonged consultations so that the clinicians in the field can better understand how to care for more complex patients. We've already gone a long way towards streamlining licensure, credentialing, and malpractice. We want to make this process seamless for the volunteers. If you're a doctor, you can donate your time. If you're not a doctor, we would truly appreciate the financial support. We'd like to grow the project coast to coast, and we can only do that if we have both motivated alumni physicians as well as individuals who are willing to provide their financial support. And a program like MAVEN, which uses telemedicine to recruit doctors from around the country to give care remotely to patients in rural areas, to patients in need. There's nothing like it. And I think this is a fabulous opportunity for a physician to be able to share knowledge, feel relevant, and continue to give back even in retirement and semi-retirement.